Links to Essentials for Childhood, the technical package, and other ACE resources mentioned throughout this training are available in the resource section. Strategies to prevent ACEs work best when used in combination. They reinforce each other and enhance opportunities to successfully address risk and protective factors across the social-ecological model. Implementing prevention strategies is a big job, and no individual or group can do it alone. Successful implementation requires collective effort from multiple sectors. Public health agencies can provide leadership and critical resources, but they need to forge partnerships with stakeholders who can help strategies take hold within families, communities, and our society as a whole. Other sectors that are vital to prevention include education, federal, state, and local government, social services, healthcare and medicine, business, justice, housing, faith-based organizations, foundations, and media.
Adverse childhood experiences is certainly a public health problem, but it's also the public's health problem. And that means that we really need to have many different groups and sectors involved in preventing adverse childhood experiences. And that's important because the impact of adverse childhood experiences is certainly on individuals, but it also impacts the community, it impacts economy, it impacts the workforce. And so we really need to have champions and partners in education and law enforcement, in the business sector, in the faith community, neighbors, and other community members who all have a knowledge of the role that they can play to help make a difference and prevent adverse childhood experiences.
Communities can use the Essentials for Childhood framework in multiple ways. First, it is really a wonderful vision, if you will, for all children and families. This idea of assuring safe, stable, nurturing relationships and environments, these protective factors to really offset any of these risk factors that we've been talking about, like early adversity, ACEs, child abuse and neglect. And it helps them to really have the shared vision in their states. So they're able to partner with other key stakeholders in their states, other sectors that really are also committed to promoting safe, stable, nurturing relationships and environments for all children. So it's a real coordinating framework, if you will, and helps and encourages and really requires that you have these partnerships across sector, across discipline. Public health cannot do this work alone. Yes, public health practitioners and researchers are leaders in this area. However, we rely on our really strong partnerships across multiple sectors, multiple organizations, multiple communities to really assure health and well-being for all children and families.
Okay, let's review concepts from this lesson.